Michigan State University is a community filled with a diverse group of students and staff. There are currently over 62,000 members of this community. Per a study done by the American College Health Association in 2014, 11% of MSU students who were surveyed reported being diagnosed with a mental illness within the past 12 months. This does not count faculty or staff, nor students with previous diagnoses. In that same survey, 50.7% of students reported stress level over the past year as, quote, more than average or, quote, tremendous. A whopping 70.1% of respondents reported that if they were having a personal problem that was really bothering them, they would seek help from a mental health professional. The problem lies in this simple statistic. Only 13% of students indicated that they have received psychological or mental health services from MSU's Counseling Center or Olin Student Health Center. MSU currently has some of the worst mental health resources in the country and the worst student to counselor ratio in the Big Ten. In 2014, the ratio of MSU counselors on staff to students were 1 per every 3,769 students. The ratio was even worse for psychiatrics on staffs to students, coming in at 1 per every 16,333 students. Just this past year, Michigan State lost a student to suicide. Because of this lack of funding, students at Michigan State are frequently placed on long waiting lists when they reach out for counseling services. This may cause an inconvenience and additional stress for many who are already struggling. In addition, those who do eventually seek a counselor may not be necessarily receiving the best of care as a result of lack of funding. Some students may feel as though their situations or stressors are not validated by being placed on such a long wait list, and in turn, the university is not validating the actuality of their mental illness.
We chose to focus on college students in the field of mental illness because that is where mental health usually begins to suffer. This can affect the rest of life through lower GPAs, increased student dropouts, poor social and economic outcomes, and even alcohol or substance abuse later in life. Additionally, it prevents involvement in faith communities, which could provide many spiritual, physical, and psychological resources if stigma did not prevent openness about needs. College students deal with all of these factors, and if schools attend to those needs now, then it can prevent problems later on. The main needs in the mental health community include the education of the public, ending stigma, and encouraging the seeking of help. These three goals are related. Stigma can be ended through educating the public, and a reduced stigma results in greater likelihood that individuals will seek treatment. Other needs for individuals with mental illnesses include treatment and aid in dealing with comorbidities and subsequent health problems. Many individuals end up with more than one mental illness, and depression can be present with nearly any other illness. Proper nutrition is difficult to obtain even without mental illness, but is especially significant in monitoring those with it, because weight gain becomes a secondary concern but still contributes to the perception of self image and self worth. A sense of control is important to individuals with mental illness because symptoms can feel impossible to manage and moderate. Controlling nutrition can improve overall health of the client. Affordable access to insurance impacts access to therapy and counseling, both of which have great effect on preventing and minimizing the effects of mental illness. The more individuals are required to receive counseling, the greater likelihood that the public will perceive treatment as a punishment rather than an aid. Additionally, in summer jobs, college jobs, and on the post college career path, employers need to make a conscious effort to engage their employees in discussions about mental illnesses and access to care. This will lessen pressures both morally and decisively based and will reduce workplace stigma surrounding these. Religious leaders are often receptive to these methods, especially in regards to specific cases with their congregations. Religious communities can offer support, financial resources, therapy, and comfort, so utilizing these resources more fully will prevent the perpetuation of stigma. They also often offer support groups.
Good. In assessing mental health, we found that this problem affects traditional students ages 18 to 24 who are attending community college or university. The problem affects 1 in 4 adults. Focusing on specifically Michigan State University, a campus which has a population of approximately 50,000 students, and since 1 in 4 adults experience mental illness within a year, we can estimate that about 10,000 people in our community battle with mental illness. This problem has been becoming more prevalent over the last decade across college campuses. We can estimate that about 10,000 people in our community will battle with the mental illness. This problem has been becoming more prevalent over the last decade across college campuses. Mental illness affects individuals of all ages, races, and genders. The problem is beginning to happen more often than not on the college campus. According to an article by the Journal of College Student Development, college students are at a significant risk for mental health problems. Symptoms of anxiety and depression appear to be the most common concerns, with studies generating prevalence estimates as high as 53.8% for moderate to severe depression and 52.8% for moderate to severe anxiety. Some of the strengths found when assessing mental health was that it begins with the courage to speak out about the problem that you are experiencing, also having available resources, and getting involved in having activists on campus. One example on Michigan State's campus of an activist group is the Mental Health Awareness Club. These students volunteer their own time without pay or salary to help other students cope with mental illness. In an article that interviewed the students who began this club on campus, it stated that their main goal was to raise awareness about how common mental illness is and wanting their voice to be heard around campus. They want to strengthen the community by raising this awareness and create a network of students who support and understand each other. Empowering a community of this nature is imperative in how they function in the world. Also, having available resources is imperative so that in the event that there is something wrong, they will have someone there that they can speak to about what is going on. It was found that some of the weaknesses in assessing mental health was low funding for resources, students being afraid to be vocal about their mental illness or acknowledge that there may actually be a problem, and lack of staff to work in the MSU Counseling Center. One of the examples is on Michigan State's campus where the funding for the MSU Counseling Center is low and understaffed. In turn, students are suffering because of it. In 2015, of the total $2.2 billion worth of operating expenses at Michigan State, Student Services received the lowest amount of funding at $52 million. The Student Services Department includes 32 different organizations. Only 4 of these programs address mental health, so we can most likely assume that the $52 million was spent evenly. Only $6.5 million was spent on mental health resources on Michigan State's campus. When we put this into perspective, $307 million had been put into the athletics department. Not having available resources or funding for resources can cause a problem because students won't be able to get the help that they need in the event that they go to the counseling center, especially if it is understaffed and no one is there for them to speak with.
The goal of this action plan is to integrate Michigan State's health and wellness services to best serve the community. Luckily for current and future MSU students, this process is currently happening. Keeling and Associates were charged directly by MSU President Luana K. Simon to create a new model of delivery that will create a co-located behavioral health wellness network. The president expressed a desire for, quote, quick-term outcomes by fall of 2016 semester to produce more immediate improvements to services for students. The recommendation of the final Keeling report are as follows. Establish a new multidisciplinary interprofessional model of care and services for students that integrates not only psychiatry service as the counseling center, but also student health services, including primary care and health promotion, to increase the university's effectiveness in supporting the overall health, well-being, and success of all MSU students. The fully integrated service should be named Student Health and Wellness Services and led by an Executive Director of Student Health and Wellness Services. First and foremost, these goals need to be brought to the attention of President Simon along with the Board of Directors. I also believe a petition should be brought to the attention of the National Alliance on Mental Illness, otherwise known as NAMI. Lastly, I believe members of the United States government should also be provided with a copy of this petition. This is because Michigan State University is a land-grant college and therefore receives federal and state funding. The government has an obligation to provide mental health care to its people, and there should be held accountable for failing programs. A government that is already on a tight budget should make sure their money is being spent on things that work. The people that would most directly benefit from an integrated health and wellness team is every student and staff member at Michigan State University. Research conducted by NAMI surrounding mental health on college campuses shows that 1 in 4 students have a diagnosable mental illness, and 40% of those do not seek help. 80% of college students feel overwhelmed by their responsibilities, and 50% have been so anxious that they struggled in school. Later in life, this can affect our greater society. Depression is the leading cause of disability worldwide and is a major contributor to the global burden of disease. 90% of those who die by suicide have an underlying mental illness, as suicide is the 10th leading cause of death in the United States. Lastly, serious mental illness costs America $193.2 billion in lost earning every year. Although a more current study has not been done yet, the amount of money in lost earnings are most likely much greater today. A key ally to this petition is the Associated Students of Michigan State University, otherwise known as ASMSU. ASMSU is the student government and attempts to create large-scale changes when students are put in danger. Student named Aaron Stevens began a student organization called the Coalition for Higher Mental Health Standards in April of 2016. This group created a petition in an attempt to draw attention to the fact that MSU's mental health resources are underfunded and neglected at every level. By April 18th, the petition gained 1,000 signatures. The group also began a trending hashtag on social media, #NextStepNow. Another key ally to these goals are other registered student organizations that promote mental well-being, including the To Write Love in Our Arms University chapter, Active Minds, and the Student Health Advisory Council. Opponents to this petition would include those who do not support students obtaining mental health care. Some people may say that effective mental health treatment is too costly and that we should focus on other activities that MSU funds, like athletics. Some people may think that a petition simply does not create any change and therefore refuse to sign it. The bias against investing in mental health care could come from inaccurate media portrayals. The media plays a very large role in the opposition of mental health treatment. The media usually portrays people with a mental illness as criminals or violent, but the reality is that not only are individuals with mental illness less likely to commit violent crimes, but they're actually more likely to be victimized. The key messages from this campaign should be that all students deal with mental illness, either personally or from friendships and academic relationships. The stigma against mental illness and lack of resources keeps students from getting the help they need. In starting this campaign, the issue of mental illnesses in a university setting will gain visibility, and in turn, the correct attention it deserves. Lastly, I believe the controversial message that could possibly set this campaign in motion is touching on the president's salary and some of the athletics department budget. Students' tuition money should be going directly towards students' well-being, but the student body is being shorted on resources that directly involves their mental capabilities. There are many strategies and tactics that could be used with this campaign. One of them could be a social media campaign, since we are targeting students directly to encourage them to advocate for themselves. Student forums would also be a useful tool, using a face-to-face technique to inform the administration about the needs and hopes of students. In joining response committees to the new integrated system, this forces the decisions to be made from the Keeling report to become personal problems for students. I believe this tactic will be the most useful in this campaign. Luckily, we have a current example of a key strategy to accomplish the goal of diminishing the negative ways Michigan State University is handling its students' mental well-being, the Keeling Report. The report recommends creating a centralized health and wellness division of MSU with both an executive leadership structure and an internal leadership structure. With this internal leadership structure, there will be a Director of Health Services, Director of Counseling and Psychiatric Services, Director of Wellness, Director of Business and Operations, and lastly, an Assistant Director of the Sexual Assault Program. The organizational chart to the right displays this structure. Not only does the Keeling report suggest a complete change in structure, but also embedding licensed counseling providers in the neighborhood clinics in addition to the existing primary care providers and health promotions and education programs in the university colleges, expanding the use of group therapy and workshops for the neighborhoods, considering the development of advisory groups that include representatives from the web of connections on campus, and implementing a 24-hour phone hotline for all of these integrated services. In this plan, students will access counseling and psychiatric services through a single point of entry where a small group of providers and staff will be assigned to intake and triage. The Counseling Center should also no longer look at behavioral health as an academic function, meaning students will no longer be able to intern at these locations. The Keeling Report requires 12-month appointments in order to effectively contribute to a coordinated continuum of health and wellness services at MSU.
In conclusion, we have learned that the need for mental health care exists very strongly in college students.
MSU is being very proactive but will need students' input. This includes being vocal about the problem, being activists on campus, and also helping to advocate for those who may not be able to advocate for themselves when it comes to this issue.
The biggest point is that difference comes from individuals working to end their own biases against people with mental illness.
In conclusion, we learned that things that we can do differently is to learn about the stigma earlier rather than later, which means educating yourself on what the problem is, how to solve the problem, and how to get help if the problem arises.
And that can be applied to any problem in today's society, but of course, we mean most specifically with mental illness. But again, in a broad sense, speaking up, speaking out, getting vocal, that is important in any advocating situation.
In conclusion, recommendations for future classes, we would say that continuing to pursue advocacy outside of class, which means attending more community events on campus, even outside of campus, doing more project work than what is assigned to you as far as trying to figure out about the problem and trying to learn more about whatever you're studying.
In addition, we also think that you should just think about the group dynamics for each assignment and try to make sure that you either really invest in the group dynamics or you all come to a conclusion that you want to do it individually. That way, no one's left thinking that we're all going to do it together and then getting confused about it or vice versa. Thank you.